You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and welcome to the Dental Zone. I'm Dr. Rachel Hall, holistic dentist from Brisbane in Australia. Thank you very much for joining me. I am here to help you understand how your dental health, your oral health impacts on your systemic health and well-being and vice versa. And as a holistic dentist, a big focus of what we do is getting to the underlying issues of why you are presenting with dental disease, things like tooth decay, gum disease, bruxism, which is teeth clenching and grinding, crowding, all sorts of things that can be going on that relate to our mouths, functionalities such as airway, breathing, jaw relationship, bite, posture, and many other things that will impact on your health and well-being, like your lifestyle, diet, nutrition, etc. And through the years, I've been practicing as a dentist since the 1990s, early 1990s. I've seen many changes within dentistry and also within the holistic field. And as a holistic dentist, we get a lot of pushback based on our philosophies and approach from within our own profession. We're accused of being hocus pocus, woo-woo, making up stuff, that it's unscientific, and so on and so forth. And I would disagree with a lot of that, because a lot of what we do is based on science, it's based on research and solid information. But there are some things that are creeping into holistic dentistry that are, in my opinion, a bit outside our remit and could potentially be causing more harm than good. So in this episode, I'm going to kind of touch on some of the good, the bad, the ugly, and the absolute bullshit that is creeping its way into holistic dentistry, and I believe is giving us a bad reputation and could be putting you, the consumer, the patient, at risk from irreversible damage and issues that at the end of the day we are trying to avoid. So before we get into that, if you want to know more about dental health and well-being, then you can hop on over to either holisticdentistry.au, which has a specific focus on mercury and dental amalgam, and you can find all the other podcast episodes on there. Or you can jump onto my dental practice website, evolvedental.com.au, and you can find out loads of information about dentistry, oral systemic health, and much, much more. But don't disappear, because we're going to jump in and we're going to get in the zone. So let's get into this, the good, the bad, the ugly, and the bullshit that is holistic dentistry. Now, I'm not trying to offend anybody, particularly not my own colleagues and those who are pioneering in the holistic dentistry space, but I do feel it's my duty of care to ensure that you understand what does and doesn't work and what is and isn't okay, because there's so much out there. And I'm not talking about misinformation, I'm not talking about being fact-checked and all that sort of thing. I don't agree with any of that, as you know, but I have a duty of care to help you understand, because I'm the one apparently who has the degree and the expertise, and you're the layperson. So let's look at the good things in holistic dentistry. That's, in my opinion, helping you get to the root cause, helping you understand why you get tooth decay, why you get gum disease, how you can change things, how you can prevent it, how you can support yourself to have better oral health. In that good would also be mercury removal, safe amalgam removal, not using amalgam, not using fluoride, not subjecting our patients to toxins, making sure that we're supporting you to reduce inflammation, to reduce stressors, and to make lifestyle changes. Now, the bad, and this will be controversy, is where holistic dentists can't agree upon things. And I'm not saying we should all have the same opinion, but you'll get one camp within holistic dentistry, and I'm going to take a controversial topic like root canal, where you're going to have some holistic dentists who swear root canal's the worst thing ever, it's going to make you sick, it's going to give you cancer. There's not enough science to make those claims. They're going to be telling you to have your root canal teeth removed and then have them replaced with implants, because implants are the best thing since sliced bread. Well, I'm sorry, but both implants and root canals have their pros and cons, and that needs to be weighed up very closely. Then there's the attitude of, oh, one person's doing something, so let's all do that because it seems like a good idea. Example would be of that was a phase or a trend where everybody was recording the electrical microcurrents running through your fillings and then deciding that the ones with the bigger currents were the most dangerous because surely they'd be releasing the most mercury, and oh, you can't do a filling on the left if you're going to do a filling on the right because you're going to kill your patient if you cross the midline. Again, nothing founded on science, and everybody did it because it seemed good at the time, even though there was no logic to it. So that's some of the bad. Some of the bad also is where we step outside of our remit and we start trying to educate patients on things that we're not qualified to do so. Like, I can give you basic nutritional advice, but I'm not a nutritionist. That is outside of my scope, and therefore we should be working with other practitioners to ensure that you are getting the right care. I also don't agree, unless somebody is trained in it, that we'd be dabbling in things like homeopathy and acupuncture, kinesiology, and all these weird and wonderful things. And look, if that's your bag, fine. But I don't think your dentist should be doing that. We should be working with science. Otherwise, we are reducing the credibility of our profession. Now, the ugly is where we get dentists claiming to be holistic, saying that they're SMART certified when they actually haven't done the certification, when they don't really understand what being holistic is, where they're telling you they're practicing safe amalgam removal when they're far from it, and they are just using the term holistic to draw patients into their practice, and they see it as a business label rather than a philosophy, a lifestyle, a way of life, and a way of supporting you to truly have the best care. Now, I think that's downright deceitful, and it is something that kind of holistic bodies and holistic groups are working on cracking down on, so that we are members of the International Academy of Oral Medicine and Toxicology, that we actually have proper certifications to be able to make those claims. So that then comes down to you knowing the facts and doing your homework to ensure that you actually are seeing a well-qualified and well-trained and safe practicing holistic dentist, and not somebody who's just jumped on a bandwagon to think it's going to help them make more money. And now I'm going to get to the bullshit. And this is really the whole part of this episode, the whole reason for me getting on and doing this podcast today. There are claims being made within dentistry, and I think it's more the maybe leaning towards holistic claims about being able to do things that are not possible based on science and human biology. Things that look like they might work if you take the right photographs and present them in the right light, and then back that with what sounds like good science, that is actually negligent malpractice and harming patients. Now, I am not pointing the finger directly at my dental colleagues, because it is very easy to rock up to a workshop that has been well marketed with a presenter who's got all this acumen and fall for what they are presenting as being the next great big breakthrough or the answer to things that we look back on in dentistry and go, oh my God, why did we ever do that? That made no sense. We shouldn't have been doing that. And it's kind of like the dentists have been preyed upon because we don't know everything. And anybody can be marketed to, and you go along and the presenter's charismatic, they're showing you all these case studies, they're showing you all these results that they've had, and you get excited because you think, hey, I'm going to be able to help my patients. But what's not happening is that the dots of science have been thrown out of the window, and what can and can't be done has been distorted. And then you, the patient, you read the fancy brochure, you see the website, you see all the promises, you see the before and after photos, and you think that this is something that's going to help you. And so what I'm referring to here is adult jaw expansion. And yes, it's took me 11 and a half minutes or thereabout to get there, but I needed to set the framework for you and explain to you that there are things that are being said in dentistry that aren't true. So if you ever see a dentist explaining or advertising that they can do jaw expansion on an adult without surgery, or that they can expand your jaws with orthodontics as an adult, I would say don't go there. Run a mile. And I'm going to explain why. When you're a child, the two halves of your palate, which is the roof of your mouth, are not fused together. You've got a left side and a right side that are joined by what we call a suture. So if you can imagine being able to pull two jigsaw piece puzzles apart, there's some give. Now, if we push on that bone by pushing out laterally, which means to the sides, we can stretch that suture and we can get bone growth across that, and we can expand a narrow arch in a growing child. After a certain age, that suture becomes fused. It becomes joined together, and it cannot be stretched, it cannot be pushed apart, and it can only be altered by cutting through the jaw, separating the two halves, and resetting them so that they are now further apart. And even when that is done, you don't get bone growing in across the gap. You have soft tissue. But yes, the jaw size is expanded because it's been surgically done. So there's now this push in holistic dentistry for jaw expansion without surgery in adults, using what are called growth guidance appliances. And these are referred to AGGA, AGGA, or FAGGA, FAGGA, which is Forward Advancement Growth Guidance Appliance. What these do, they are bonded to your teeth, and there is a turn screw which the dentist once every few weeks sees you, and they adjust that screw. And they tell you that by doing so, that is going to expand your jaw. And if you expand your upper arch, then that's going to determine a better position for your lower jaw, and that's going to improve your airway. So you're going to be able to breathe better, you're going to be able to sleep better, you won't get sleep apnea, and it's also going to improve the position of your jaw joint, your TMJ, and it's going to stop you clenching and grinding and stop you having issues with your jaw joints. And they say it's never too late to treat patients with an underdeveloped upper jaw. It is generally accepted that orthodontic without extracting any teeth is the way to go. Now, I would say, yes, if you've got a small upper jaw, you shouldn't be taking out any teeth because then you're going to make it smaller. But then saying that you can expand adult jaws with these appliances. But we're going to expand in a different way. We're going to give you maxillary advancement. Now, maxillary is the name for your upper arch. We're going to create more space for your tongue, and we're going to facilitate improvements in your airway, your TMJ pain, and your aesthetics. We're going to make your face look wider and broader and fuller. This is going to do more than straighten your teeth. It's going to improve and change your complete profile. Now, that sounds amazing, doesn't it? And then they'll show you lots of pictures to show it's improved their bite, improved their profile and their posture, tell you that it takes just a few months to advance them, and then we get braces. You're going to improve the position of your lower jaw. And they're going to say, you've got this fixed appliance, the FAGGA, and it's a fixed anterior growth guidance appliance. You can't take it out. You go for your adjustments, and the upper arch expands anteriorly to the front by about 1 millimeter a month, creating spaces between your canines, which are the big pointy teeth at the front, and the small premolars behind. And then once you've got the space, we're going to put in a wire to hold that space so your teeth don't collapse back. And then we're going to do orthodontics to pull all the other teeth forward. And voila, we have made your jaw bigger. Bullshit. Total lie. It is bullshit. All this appliance does is push your teeth so far forward, it pushes them out of the bone. Your teeth need to be in bone. This appliance pushes them outside of your jaw. Your jaw's not expanding. The bone around your teeth is not expanding. You can, with orthodontics, get a little bit of expansion, but you can only move the teeth as far as the bone allows. If I want to make my room bigger, I can't do it by pushing the furniture outside of the room. The space of the room stays the same. The only way I can make my room bigger is to knock the wall down and build a new wall in a new position. That's jaw surgery. I cannot push my furniture outside of the room and then tell you, because the furniture's in a different position, that my room is bigger. Does that make sense? I hope so. I hope you're following this. So this appliance is essentially just pushing the furniture outside of the room, where it's completely, the furniture being the teeth, where they are now completely unsupported by bone. What do you think happens to teeth that get unsupported by bone? That's right, they fall out of your mouth. This appliance and appliances like it that are claiming to expand your jaw without surgery are just simply pushing your teeth out of your mouth. Then you are left with irreversible damage. Many patients have lost teeth from having this treatment done. They have had resorption of their roots, which means the roots that hold your teeth in the bone get destroyed and eaten away by the excessive forces of pushing the teeth so dramatically and so far. So you now have teeth that are out of bone and teeth that have less root in bone. Now, unless this is picked up to your eyes, and often to the eyes of the dentist, it looks like your teeth are in a nice alignment, better position, and you have got a bigger mouth and bigger profile. But no, what happens is they push your teeth out of the bone, they make big gaps at the back, then they try and pull the back teeth forward. Now, those back teeth are bigger and more robust than your front teeth. And for every force, there's an equal and opposite force. And so as they start trying to pull the back teeth forward, they end up just tipping the front teeth and jiggling them around. And you don't actually get any extra space. Your teeth end up doing what we call round tripping. So they go out, they go forwards, and then they get pulled back. But they're still out of the freaking bone. The damage has been done. Or they push the teeth forwards and then they say to you, oh, now you need 2 implants to replace or make up for the extra space. Your bottom jaw has not been altered. It hasn't been expanded. It hasn't been moved. And therefore the top and bottom jaw don't fit together properly. You are forced to either posture your lower jaw forward, which means pushing your chin out to get your teeth to bite together, which causes more strain on the TMJ, or you have to put up with the fact that you've now got what we call a big overjet, which to you guys means a big overbite, which means your top teeth stick out way further than your bottom teeth, and your teeth don't actually meet together properly. So lo and behold, the dentist now, ka-ching, ka-ching, 2 implants with crowns to fill in the spaces that they've created in your top jaw. Oh, now your bite doesn't meet, but this is where your jaws are supposed to sit. So we're going to rehabilitate your bite by putting crowns and onlays on all your back teeth so you can meet together again. Tooth destruction of teeth that didn't need crowns and onlays, and ka-ching, money in the bank for the dentist doing these appliances. Now, I'm not saying that they are sitting there calculating, ooh, I can make lots of money from this. These dentists genuinely believe they are doing the right thing by you because they have been suckered in to this complete bullshit treatment that does not work. And if you don't believe me, go on YouTube and Google FAGGA or expansion of adult jaws, and you will see loads of stories of people saying that this treatment destroyed their mouth. There is currently, at the time of me recording this, a class action happening in the US where patients who have been harmed by this appliance are suing the person who designed it and came up with the treatment. It is dastardly. They are promising you that they can give you a smile that will look so divine, so beautiful, so aesthetically pleasing. It's going to change your face. It's going to improve your airway. It's going to fix your TMJ issues. And all they are doing is destroying your dentition. Now, these patients, their bone has been so damaged that they often cannot have implants to replace the teeth that have been pushed out of the bone and destroyed. What does that leave them with? An unstable mouth where their teeth are just loose and are going to fall out? Surgery to try and bone graft and put in some implants somewhere? Full clearance? All their teeth out because they no longer are housed in their bone? Or dentures? Now, in some cases, it can be caught early with 3D x-rays, what we call a CBCT, and the treatment can be stopped and the teeth can be pulled back into a better position, but the damage has already been done. Some of the signs that this treatment's not going well is recession over particularly the front teeth, where the gums just dramatically recede, where people never had a problem with their gums previously. This is a bullshit treatment. Now, I'm going to cop some flack for this. I'm going to be very hated upon for exposing this, but I have witnessed too many patients damaged by this procedure, one of whom should never, ever, ever have been treated for the condition that they presented with, was never a case for braces, never a case for this appliance, and should have only been treated surgically or left alone. And now this person is facing having to have jaw surgery to correct the damage, to try and put right some of what's gone wrong. To me, that is gross negligence. If you are a child, or you have a child, you can expand their jaw. They are still growing. We can maximize that growth for them. In an adult, it just is not possible. This is BS. It is not based on science. It is based on, this seems like a good idea. Let's do this. They know, the manufacturers and the trainers of this know that this stuff damages. Las Vegas Institute of Dentistry used to back this and promote it. They have now stood completely apart from it, and they have been litigated against, as far as I am aware. I do not want to defame. That is what I have assumed from what I have read and heard. I want to make sure that you don't fall foul of this, because the marketing is very, very convincing. Here in Australia, I know there has been many reports to regulatory bodies, and a lot of cases have been settled outside of court, and then people have to sign a waiver that says they can't say anything about the care that they got. So if you're considering having an appliance to grow your jaw without surgery and you're an adult, I'm going to tell you to stop, think again, and do your research. If you've already had an appliance, I would be getting some follow-up CBCTs and maybe have a consultation with a specialist to see where your teeth are in relation to your bone. Now, not everyone's going to experience damage that is so extreme as I'm pointing out in this podcast, but how do you know? A photograph of the outside of your mouth does not convey what's going on underneath. Only radiographs will show this. If you've had this sort of treatment and you're listening to this, I urge you to get your mouth checked out. If you're in the middle of this sort of treatment, I urge you again to get your mouth checked. Just put a pause on things, see where things are at, and see and make sure that your teeth are not pushed out of the bone. Some of the risks that are associated with braces, and this is documented on a dentist website who does this treatment, and it shows a basic lack of understanding of what the warning signs are that your orthodontic treatment is causing harm. So they say, number one, gingival recession, gum recession. Now, gum recession, that happens not through gum disease, but from tooth movement, is a sign that your teeth are being pushed out of the bone, and treatment should be immediately halted and specialist advice sought. But they say here, gingival recession's a risk. Yes, it is, but not 5 or 6 millimeters or 8 millimeters, 10 millimeters like I've seen, where a patient's tooth that was completely healthy got pushed so far out of the bone that there was no choice left but to extract that tooth. Now, the moment they saw that recession was happening, treatment should have been suspended. Then, number 2, non-vitality. Teeth may die. Now, teeth die. A healthy tooth doesn't just die. Teeth die when they experience trauma, when they have excessive force or they get infection. Now, if you've got a perfectly healthy tooth with no disease, it will not get infection. But if you exert enough heavy pressure and force on it by pushing so hard on it that you can breach the bone that holds it in, you can and you will kill that tooth. Do you think that's a good outcome from treatment? That you can end up with 1, 2, 3, 6, 10 dead teeth that then will need root canal and crowns? I don't think that is a good treatment. They're saying they know these are risk factors. Then, speech impediment during the course of treatment. Well, if you're pushing somebody's teeth so far forward that their tongue can no longer make contact with the back of the teeth when speaking, you are going to create speech impediments. Then, root resorption. The roots may become shorter. What they don't tell you is that the risk is that you'll end up with severe root resorption. So instead of your root being 1 centimetre long, it can end up less than 4 millimetres. You need root to hold your teeth in. Now, they would argue that these risks are associated with normal braces. And I would say yes. But with normal braces, those risks are very tiny. Very, very tiny. You will get 1, maybe 2 millimeters of gum recession depending on your crowding, depending on your teeth position, and depending on your gum type. You may get teeth die. I have never in my 30 plus years career met a patient who's had a tooth die from having traditional braces. You may get a speech impediment during the course of your treatment because it's hard to talk with braces on. And yes, sometimes depending on your tongue size, whether you've got a tongue tie, the shape of your jaw, you may end up with a little change in your speech. But normally, in most cases, your body adapts and that speech issue goes away. Yes, you can get some root resorption, but it's usually so small, it's clinically, it doesn't matter. I couldn't find the word that I wanted there, so sorry on that, but it's insignificant. It's clinically insignificant. So what they're doing is they're trying to cover their ass by saying, oh, but these things happen if you have normal braces. No, they don't, not to the extremes. So I'm going to call this a bullshit treatment. I'm going to say it has no science, it's not backed. Speaking with specialists, speaking with other clinicians, they all know, the specialists all know the harm of these appliances because they're the ones who are having to deal with the patients and try and help them save their damaged teeth, or they're having to put right the issues. I am horrified that this treatment is still allowed. I am horrified that dentists are still allowed to provide it. I am horrified that our governing bodies, despite the fact that there have been claims against dentists providing this treatment, have not stepped in to stop the treatment being allowed here in Australia and elsewhere. What they do is they put that dentist under supervision and tell them that they're only allowed to do orthodontics if they're doing it under the supervision of a specialist orthodontist, and they have to show and document all their cases and undergo retraining. But that may stop that one practitioner from providing FAGGA or AGGA or jaw expansion without surgery on adults, but it's not stopping others from doing it. Because unless you have a complaint that gets upheld by the regulatory body, you can be doing a great deal of harm to your patients and be completely oblivious to it. Or when you see that harm is happening, you do not have the understanding and the training to be able to correct it, to be able to change tack, because this is a cookie cutter prescription. These are not orthodontists who are trained in diagnosing, treatment, and being able to pick things up and correct them as they go. No, they've been given, you do A, you do B, then you do C, you do this, you do that, you do this, you do that, and they have got no idea what to do when things are going wrong, and they just push on with treatment to get you to the so-called end result, and then they leave you with a completely destroyed and disabled mouth. I know this has been a bit of a rant, and it's probably a topic that you've never come across before, but I'm seeing this promoted more and more and more, and I am super concerned about the harm being done to our patients, the harm being done within the profession. I don't think it's fair to train somebody that this is the way forward, that this is the new advance in orthodontics, this is, going to be something that changes the face of the way we do braces forever, when it is absolutely not that at all, and it is doing a lot of harm, and nothing's being done within the profession to counter that. And so I want to bring this out into the open. I want to make it public knowledge that this is not something that's going to give you a divine looking smile. It is something that is going to destroy your mouth, and it is going to leave you potentially a dental cripple. You could have gone and had perfectly healthy teeth. You've never had any problems. You've never had any gum disease. You've got a small airway, or you've got some TMJ issues, and you think that this is going to be the solution because you don't want to be on CPAP or wearing a night guard for the rest of your life. And they're promising all these things that they just cannot deliver. And then they've been duped, and you've been duped, and you're the one who has to carry the can, not the dentist. Most of the time, the dentist is completely oblivious to the damage and the harm that they've done because they're not trained to look for it. So don't just take my word for it. Go and look up adult growth expansion or growth guidance expansion, AGGA or FAGGA, and you will see, there's some out there saying, this is great, and it's often somebody who's been on the journey themselves, and they're like, look at the shape of my face. Well, the shape of your face doesn't tell me how much bone you've got. The shape of your face and the alignment of your teeth doesn't tell me whether they're sitting in bone, whether you've been given terrible recession, whether your roots have been eaten away, or whether your teeth have been killed by the treatment. But go on YouTube, go and have a look. There are many, many videos coming out now about how damaging this sort of dental bullshit is. And so my job is to help you understand what's fact, what's fiction, and what's downright harmful. So we're going to have dentists argue with us about, no, dental amalgam's fine, mercury's okay in your teeth, da-da-da-da-da. That's fine, let them. But there is science to back up what we're saying about mercury and mercury toxicity. It's very well documented. But these growth appliances to expand adult jaws have no scientific foundation, and the science all points to them being harmful. So if you are an adult considering having braces, considering having something done to improve your airway, please do your research really, really well before embarking on anything. And if it sounds too good to be true, then I'm going to tell you it probably is too good to be true. I don't want you to become another one of the statistics who has had this appliance and has now had their dentition and probably a lot of their life destroyed and the quality of their life destroyed because this appliance pushes your teeth outside of your bone, outside of where your teeth are meant to sit. I hope you found this enlightening. I hope it's raised some questions for you. If it's not, then I'm sorry, but I did need to say something. Like I said, I'm going to be very hated within the profession. I'm already not that popular because I do talk openly about these things, but this was something I couldn't just sit back and not say something about. So I'm Dr. Rachel Hall. This is the Dental Zone. I do appreciate you tuning in and joining me. If you like the podcasts, then please share them, get them out there. And if you'd like to know more, hop on over to holisticdentistry.au or evolvedental.com.au. And if you would like to see me, for me to be your dentist, to have a consultation, have safe amalgam removal, help you have a healthy mouth for a healthy life, give our rooms a call, 0737 201811, and my team and I would be delighted to see you and help take care of you. Thank you so much for joining. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.